Hello and welcome to this discussion, Vaccines in Adolescents. Why do we need our HPV shots? My name is Drea Douglas. I'm the Learning Coordinator here at the North Bend Public Library. With me on the technical end is Paul Addis, Reference Librarian at Coos Bay Public Library.
Howdy.
And North Bend Libraries are very happy to be able to have this presentation, and we're delighted that OHSU and North Bend Medical Center have agreed to help us with this. And we are joined by two doctors from North Bend Medical Center and a practice enhancement research coordinator, or no, I'm sorry, she's not here with us today from OHSU, but she was on the back end. So Dr. Jenny DeLeon did her undergraduate work at Harvard. Her medical was at University of Vermont, and since 2004, really? You've been in North Bend that long?
I have.
And lovely too. Dr. DeLeon is board certified by the American Board of Pediatrics. And that's right, joined NBMC in December 2004. So there's a lot of people in our community who have taken their kids to see her. We all trust her and love her. Dr. Menika Rastogi, born in Trinidad and Tobago and attended the University of West Indies at Mount Hope campus in Trinidad. She graduated with honors in anatomy, physiology, pharmacology, and obstetrics and gynecology. And I'm kind of like, I'm with Paul. Like, okay, I can put a Band-Aid on myself and feel pretty proud. She has won awards. She has presented at conferences. And when last we spoke, I was saying, oh, as an endocrinologist, she's perfect for this lecture. And Dr. Rastogi said, no, I think you mean immunologist. And I realized what I meant to say was that I know that the endocrine system goes through massive and wild changes as a person ages, starting, at birth and just becoming an adult. And the fact that this is a vaccine that is so specifically targeted to an age range, I thought that was my thinking for that. So with that, we're now going to let our doctors talk, and we'll have some questions afterwards. And we thank you all for joining us. With that, Dr. DeLeon.
Hello, everybody. So I'm going to do a little bit of clicking here and share my screen. Done. Everybody can see my screen? Excellent. Okay. So what I did is I looked for pictures of HPV, and I also looked at some good videos that can give you an idea of how the immune system works. So this is a picture of some HPV vaccines. You can see them all there. And when you look at one of these, and I'm going to pick probably the one that looks like a honeycomb in the middle, but towards the left and lower. And you can see that there's some green stuff that's in the middle, and then some blue stuff that's on the outside. And what we're going to be talking about is the blue stuff here on the outside. So what a virus does is it sees a cell, and our bodies are all made up of different cells. And in this case, what we'll be talking about is the cervix, which is the opening to your uterus. So if a woman gets pregnant, the uterus is what carries the baby, and the cervix is the opening to that. And for some reason, there's certain kinds of this HPV vaccine that sees these cells on the cervix, and they attack those cells, or they get themselves into those cells, and then they make those cells make more copies of themselves. So here's another picture of an HPV vaccine, and you can see kind of on the outside is all this fuzzy stuff, and that's what we call surface proteins. And those are proteins that they are like a key to unlock the door into a cell, and then the cell will take them in. And I will see if I can find, here's another picture. This is more kind of artistic than it is truly a picture, but you can still see these green little globs on here. And here's a picture of the virus attacking the cell. And let me show you. So then there's the cell, or there's the virus kind of floating around, and it'll call itself a virus particle. And it floats around, and you'll pretend that this is like a cervix, these cervix cells that are right below. And then at some point, one of the keys hooks on to a protein that's right on the surface of the cell. And once it's done that, this is the key that tells the cell, hey, let me in. And then the cell gets tricked by these proteins, and you can see it says viral surface proteins that attached to the surface of the cell. And you can see right there, there's the cell receptor. They call it a receptor protein because it's like a reception area. And that allows, or that makes the cell say, hey, come on in. And there's the door to the cell opening, and there's the virus coming on in. And that's how a virus gets into a cell. Okay. And here are some actual real pictures of that happening. If you look up in where it says letter A, you can see those viruses kind of knocking on the door of the outside of the cell. And then you go, and then you can see how the cell's kind of making little dips there. And there's a cell in box number B where the virus has attached and the cell is now letting itself in. And then you look at letter D, and there is this virus has entered the cell, and there's another virus that's entered the cell. And these are actually HPV viruses that are entering the cell of a cervix. So after that happens, I'm going to explain to you how a virus kind of works. It lets itself into the cell, and then it tells the cell, hey, you need to make more of me. So there's the virus attaching to the cell. Whoop, it attached, and now it's coming on in, and now it's on the inside of the cell, and it's going to go into the nucleus, and that's the part of the cell that controls what everything else does. So what it does is it tells the nucleus, hey, make lots of me, and what I made up is DNA and proteins. And so now the cell is making more proteins, making more DNA, and making more of a virus. So now we're making another virus, and another, and another, and another. And so all these cells are basically making more and more and more viruses. Okay, and here's an example. Here's another real life picture, and this is a cell that's been invaded by a virus, and you can see, and you can't see the entire cell, but this part is the nucleus right here, and this is just the inner parts of the cell, and you can see they're almost locked up like an army. They're all lined up, and they're ready to burst out of the cell. And so that's why if a virus gets into a cell, it can make thousands, millions of copies of itself to go and invade other cells. So what your immune system does to attack it, and I'll show you this, it has many different cells that kill viruses outright, and other cells that tell its other cells to attack as well. And so this is another video of that. So here's your friend, the virus, and it's kind of floating around, and it just got glopped up, and then you see another cell, and another cell, another virus, and all those viruses are getting pulled at and attacked, and then it goes into, and this is called a macrophage, which literally means cell that eats stuff. And so what it's doing is it's taking all of these viruses and it's eating them and chopping them up into little pieces. What it's also doing is taking those little pieces and releasing them so that the rest of the immune system can work on that. So you can see all of those things that they're making cytokines that are kind of like a bugle that calls, hey, you guys got to come here and help attack. And these are some cells that are helping to attack. And they just basically are just trying to get as many of those viruses as possible. So there's this war that's going on whenever a virus attacks. But every so often you'll get a virus that has made its way through and it didn't get attacked and it survived. And that virus, you get that one and it can start invading and reproducing again. This cell right here is called a dendritic cell, and what it does is it takes kind of all of the virus particles that are kind of floating around, and it will travel to your lymph nodes. If you remember in your neck, you can get lymph nodes that get bigger, and that's basically it working to attack something. And so that cell goes to your lymph node and says, hey, helper T cell. And where you see helper T cell, that's kind of like the general that directs the armies. And so it says, hey, helper T cell, that was a communication saying, hey, if you recognize these proteins, that means you need to attack. And so that T cell tells the B cells, here's our plan, these are the things we need to attack, and now the B cells make tons of antibodies. And these antibodies will work specifically for the against the virus, and you'll make millions and millions of them, and then these antibodies will attach to the viruses, and number one, make them recognizable to get eaten and killed, and number two, make it so that those viruses are now, their keys are now covered with them and they can't cause infection. So what vaccines do is basically you're taking those keys or those outer parts of the virus that, that the body can recognize, and that's what is inside a virus. So you get injected with, what they do is they'll take the outside parts and then they'll inject that, and then your body says, hey, this does not look, or this looks like something that we should attack if we see it again. And so what it'll do is make it so that if you get exposed to that virus, your body already recognizes it and attacks it immediately. For example, say if you get infected with something and you're not vaccinated, it takes your body a while to generate an immune response, and sometimes that may be too late. And what vaccines do is make it so that your body can recognize it, so that that response to kill that virus or bacteria happens immediately before you can get sick. And so with the HPV vaccine, they're taking the outside parts of the HPV, and that's what's going in the vaccine so that your body can recognize it.
So a vaccine pretty much just is trying to mimic what the body does anyway. Or
the vaccine
that's probably a bad question.
I guess the vaccine mimics the virus, even though it's dead or there's just parts of it that can't infect you.
Right.
And then that generates your immune response, so that if you do get exposed to that virus again, it's already going to attack it.
It already knows what to expect here.
Correct.
Thank you.
And I'll stop share now. Did that work?
Yeah, very cool. Nice military analogy too. All right, is Dr. Rastogia?
Yep, I'm here, I'm ready.
Okay.
All right, so I'm going to share my screen now, and hopefully everybody can see and hear me, okay?
Yeah, we can hear you
Awesome.
fine, thank you.
So I actually have a cool little video at the end that's just about 2 minutes long that's going to help explain what Dr. DeLeon was trying to explain, you know. How does a vaccine help? So I think that's going to be pretty cool. So I'm going to do my screen share, 1 minute. And share. Are we there? Can we see?
We are there. You could probably make it full screen.
Yeah, hold on. There you go.
Perfect.
All right, hi everyone. Well, we've been very excited to do this presentation, so it's definitely something I feel passionately about. You know, all us pediatricians at the North Bend Medical Center and, you know, at Coos Bay, North Bend in general, we really believe that vaccines help. And I do get a lot of questions about this vaccine in particular. And I'm hoping that by going through this, that we can really help people to be less confused. So what is the human papillomavirus? So the human papillomavirus is a type of virus that it lives in moist surfaces, moist areas of the body, and it is transported, it's transmitted to people during sharing of bodily secretions or sexual activity. The next thing I'm going to cover is, you know, what is the HPV vaccine, why we recommend it, and then we'll have some questions at the end. Okay, so to expand on what the HPV virus is that it's very common, and it has been found to actually be a cause of types of cancer. And the way that happens is the same way that you saw in that video. Basically, what does cancer mean? It means that your cells are taken over by something and they all of a sudden start growing out of control. So we call that growth malignancy. They behave badly. Something malignant is bad. And they spread all over the body and they interfere with things. And these viruses, because they go into the cell and they change the DNA, which controls how the cell works, unfortunately turns those cells into a type of cancer. And the most common cancers that we see are in the mouth, so that's what oropharyngeal means, around the anus, so that's around in the buttock area, around the penis, around the cervix, the vulva, and the vaginal area. And it is spread through direct skin-to-skin contact, and like I said before, most commonly through intimate contact there. And you can see the percentage of cancers that it would be causing over there. 91% of cervical cancers, anal cancers, rectal cancers, and all of those. So this is just a diagram showing exactly that you get HPV, and I put the throat there because, you know, we talk a lot about anal and penile and cervical cancer, but there are other types of cancers that the HPV virus causes, and commonly it does cause throat cancers. So that's just a little heads up that we're not just only protecting one type of area of our body or from one type of cancer. There's multiple. And so you can see that this little virus is taken into the cell, and these things called messenger RNA are basically carrying the viral messages to the cell that's causing this malignant proliferation, there's that word again, and leading to the cancer in this case. So it's basically hijacking your cell and taking over. It's like, you know, when your computer gets infected and the virus takes over your computer and then you lose control, that's what this thing is doing. So how common is it? You know, it's very common. Most people get infected and they don't even know it, which means that if we do get infected, how would we treat it? We have no idea because we don't even know we have it. Many will go away on its own, but for some reason in some people, the virus will stick around and it'll just mess with the cells and cause all of these bad effects. And we don't know which one of the people who get the virus will have cancer or not. So there's no way for us to tell. And, you know, it's linked to 33,000 cancer diagnoses in the US each year. And when you look in percentage of cervical cancer, how many are caused by HPV? 70%. So that's 7 out of 10 of cervical cancers are going to be caused by HPV. And, you know, there's another scary statistic that pops up. I think that's going to come up on the next page. In that, you know, in one of the articles I read last night, by the time a woman is in her 50s or 60s, 4 out of 5 of them will have been exposed to an HPV virus in the cervical area. So that's really quite staggering. So the other thing to realize is that when we do get the HPV infection, your doctor is not going to be able to treat it. Your doctor doesn't have a treatment to make it go away. It has to go away on its own. And your doctor has no way to prevent you getting the cervical cancer or any other type of cancer once the HPV infection is there. That really kind of sucks. So all your doctor will tell you is, okay, you got HPV. And then you'll say, okay, what next? And we'll say, well, we'll just keep checking to make sure you don't get cancer. So there is no treatment to make it go away once you've got it. So how can you protect your child? You can vaccinate. And this vaccine has been around actually for quite a while now. And it is very, very effective. It can prevent more than 90% of HPV-related cancers if it's given before you get exposed to the HPV. If you give it after, the damage is already done. And like we said, if you actually get the infection and you're lucky enough to realize you have it, because remember, most people don't even know they have it, then there's no treatment. And so this is just another slide showing that this is the vaccine, it's getting injected, and it's going to do all of those wonderful things. It's going to make our army ready to fight the virus so that as soon as we get it, our body already knows, okay, this is bad. It doesn't have to think about it. It doesn't have to build memory. It doesn't have to build defenses. Defenses are already there. It's going to build all of these wonderful cells up, H cells, helper cells, B cells, T cells, memory cells, and plasma cells, and it's going to activate that so that when you are ready, all of this stuff is good to go. And I remember Drea had thought this was interesting when we were talking about it, that actually when you get a vaccine and you get a little bit of a fever the next day, that's because your body is activating its immune response to prepare all of these memory, helper, and antibody generating cells so that whenever you do get exposed, that you don't get sick. So the fever sucks, but it's not necessarily a bad thing. It's actually a sign that, hey, my body's trying to help.
Does this mean we shouldn't actually be trying for using fever reducers, or pretty much by the time you realize you have a fever, it's probably done the work and it's okay to take medicine?
So that's an interesting question. They have found that if you give Tylenol, specifically a fever reducer, before you give a child their vaccines, that you interfere with how well the vaccine works.
Ooh.
So it's okay to give the fever reducer after the vaccine is given, but you're not supposed to give it before. So there is a definite link to being able to activate your immune response. So where does the vaccine come from? So what we do is we take a virus and we mess with it. It's kind of cool how they mess with it. I wish I could do that kind of stuff, but they basically interfere with it so that it can't harm you in any way. And then they give it to you in that interfered form into your body, or they extract a protein and they put it into a form that's safe to be injected, and they give it into your body. And so it's made from a type of protein. And a lot of people worry about with the HPV vaccine, well, what are the side effects? You know, the most common side effects you're going to get is what you get from any vaccine. It's going to hurt. You know, your muscle's going to ache for a while. They say some people feel dizzy or some people feel faint. And, you know, that happens to a lot with the tetanus vaccination that I give to my teenagers. It happens with the meningitis vaccination that we give to our teenagers. So they do think that that is just kind of something that may be common at that age, but they do say watch out for it, you know. You might have a headache, you might feel tired, you might have muscle or joint pain. And these are really, really common things that we see with other vaccines anyway. For example, the flu shot. Really similar feelings. And, you know, this is the key that I think everybody wants to know. You know, is it safe? So since it's been licensed The World Health Organization did a wonderful review in 2017. And I just found it fascinating because they brought together a global advisory committee and they just looked at all of the millions of doses that have been given around the world. And they found 270 million doses. And why is that important? Because the more times we give, the more people we give something, then the more accurate we can be about side effects. And so this is what they found. They found generally, and I actually said this in my clinic today to one of my patients, that if all of the side effects that they did find that were linked, and generally it was like dizziness and fainting and the risk of allergic reaction, were around 1 in a million. So very, very low chance. So to put that in perspective, you're more likely to get hit by a car driving somewhere between your house or school or house in Eugene or house and work than you are to experience a side effect, a severe side effect from this vaccine. You know, can we ever promise that there will never be side effects? Absolutely not. And I can't promise that for anything, not even for Tylenol. You know, there's side effects to everything that we do, but I can tell you that with these ones, this is one of the some very, very low risks of side effects. A lot of things that are out there when you read on the websites, something called POTS, which is postural hypotension, where you feel dizzy all the time. Something about pain and chronic pain syndromes. In the millions of people that they studied, they said there was no association with the vaccine at all. They looked very closely at a neurologic problem called Guillain-Barré disease. And again, in the UK, in more than 10 million people, they were not able to say that this was a significant cause or even association with this particular vaccine. And so after that 2017 meeting where all these people came together from different countries all over the world, they said, you know what, this vaccine, it's safe, and we're going to start a global initiative to increase HPV vaccination everywhere. So that made me feel a lot better about what I tell my patients. And the thing about it is that since they've been giving the vaccine, because they were able to study so many millions of people, they found that 71% less HPV-related cancers are recorded. So basically, they're reducing cancer rates by up to 70% by just giving a shot. There is no other cancer we can prevent like this, none. And is cervical cancer different from lung cancer or brain cancer or breast cancer? No, it's just as bad. It spreads all over your body. It invades your bones. It invades your brain. It causes all of the other symptoms of cancer, cause weight loss, tiredness, bone pain, and eventually death. And, you know, a slow death. You know, that's the bad thing about cancer. It really just kind of takes you over. So, I mean, to say that it can prevent up to 71% of those cancers from happening is actually quite amazing. So when does your child need the vaccine? We want to give them between the ages of 9 and 12 years old. The CDC says we can start from age 11. The AP says we can start from age 9. So, but on the vaccine box, we can start at that age. And at that age, we can actually give 2 doses between about 6 months apart. At age, there's actually an age cutoff though. So after age 14, if you get the vaccine above that age, then you actually need to give 3 doses. And I think there's some questions on the FAQs about why that is. And it has to do with how well your body can mount a response to the vaccine. And they find that if they give it in the younger ages, that those 2 doses are good enough. But in the older ages, for whatever reason, they need that 3rd dose. Who pays for the vaccine? Well, we're very lucky in the state of Oregon that whether you have insurance or no insurance, you'll get your vaccine. We have a vaccines for children's, it's called a Vaccine for Children organization, and they send vaccines to us. And so if you have health insurance, all insurances will cover it. If you don't have health insurance, we pull out from the Vaccine for Children supply and you get it. Really simple. So I think the bottom line here is HPV is cancer prevention. And now I am going to play my little video. Hopefully this will work. Just thinking about it.
Immunity is a natural defense system of the human body. Imagine millions of immune cells, like white blood cells, all on the lookout for specific germs. If they spot something dangerous, like flu, they prepare to fight. When that flu bug enters your body, the white blood cells move in on it. The immune cells arm themselves and then replicate, creating an army of clones. Then they launch powerful germ-killing agents called antibodies, and they tag the germs for disposal. Once the germ is removed, the immune army can disband. But they leave behind memory cells. Their job is to remember the invader and to sound the alarm if it ever appears again. The first time around, it can take at least a week to mount the defense. But next time, the system is prepared. The whole process takes barely a day. It's so fast, we may never have time to even feel sick. A vaccine pre-arms the immune system by sending in a weakened or dead version of the germ, just enough to be recognized. The immune cells mount the defense, and again, you may feel the effect. But because the threat is low, the immune cells quickly disband. However, the all-important memory cells have been created. The immune system's now prepared for the real germ, but without causing full-scale disease.
And there you go. I think we're ready to move on to the questions now.
Okay. Can you stop your share?
Darling. That was so darling.
Yes.
Doctors, thank you so much for your presentations. We do have a couple of questions. I have one, it is not from me personally, but it's one I've heard, which is that some people wonder, if there's a moral value to having it? Isn't it like telling kids to go have sex is the worry? What's the response to that from the medical community?
I'll go with this one. Actually, surprisingly, there have been studies about this. There have been many parents who've been concerned about whether giving this vaccine is giving a message to their children. And they've actually studied teenagers who have had the vaccine and teenagers who have not had the vaccine. And there's been found to be no difference as to when they become sexually active. So giving the vaccine has not changed when teenagers become sexually active.
Okay, thank you.
Isabel, do you have a question?
I got a question. So, and this is for, I guess, Dr. Stogie. I saw on one of your slides that you can initiate the vaccine and start it at age 9. I'm seeing some conflicting information out there that some people want to start it, it's recommended between 11 and 12. Can you talk a little bit about the benefits of starting the vaccine at age 9?
So you're correct. So there is 2 different recommendations out there, and one of them starts at age 9, and the CDC says to start at age 11. Really, if you look into it, what the blanket statement says is that it can be given between the ages of 9 and 12. And so the benefit given at either age is about the same. But what's good about age 9 is that, you know, younger kids are more likely to be coming in for their checks. So we're going to get them, we're going to be able to catch them early. And then secondly, when you are 11 or 12 years old, there are other vaccines that you need to get at that time. So by starting it at age 9, you may just be able to say, okay, you just get this one shot today, which is a lot easier to tell a patient than if they're 11 and you're like, okay, well, you need to get this, and you get the tetanus, and you need to get your meningitis, and oh yeah, by the way, we have this other vaccine too. So, you know, it makes it a little bit easier on the patient, and by starting it early, we're more likely to be able to get all of the earlier doses in before, you know, basically it's, you get beyond the age where we have to do 2 shots versus 3. So I hope that was helpful.
Yes, thank you.
Definitely. I had a question as well. So you went over the requirement of more shots as you get older, but I didn't catch the why. Why do older kids need more shots? You know, why does the older initiation of the vaccine mean my child needs like 3 shots versus 1?
So it has to do with the reaction of the immune system. So as like the little video showed, right, it's generating memory cells. And so depending on the number of memory cells and antibodies that are generated will let you know, okay, how well is this vaccine going to work, and is it going to last for the rest of my life? And there's just something that about that age difference that
Sorry.
above age 15, or yes, I believe age 14 or 15, that to get the amount of immune response we need to ensure that it works, that we need to do those 3 shots, but were able to study the younger kids and find that their immune system works better for this vaccine, and so saves you a shot basically.
Cool, thank you.
I have one. I know you talked about side effects, and most of the time it's a mild one, but there can be severe. But from what you're saying, it's 1 in a million to get a severe side effect. Can you? I guess can you? It's so it's not linked to any severe side effects.
Correct. So the severe ones that they talk about there were the postural orthostatic hypotension, and really it's the Guillain-Barré, which is a neurologic problem that really scared a lot of people. And they were able to find in quite a few studies that the chance of that, if that does occur, is less than 1 in a million. And they were able to say that they would not call the HP vaccine a cause for Guillain-Barré disease at all.
That's good to know.
I've got a question for Dr. De Leon. Can the HPV vaccine make you sterile?
That's an excellent question, and I know that there have been parents who have had that concern, and the HPV vaccine cannot make you sterile. It cannot at all.
All right, thank you.
I had another one for Dr. De Leon.
Uh-huh.
So if you have HPV, will you eventually get cancer? Because I think I heard that if you do get HPV, there's no treatment for that. Is that correct?
Correct. There's no treatment for that. So if you have the HPV vaccine, it increases the chance that you're going to get cancer.
But not everybody does.
Not everybody does.
Oh, okay.
Correct.
Because it sounds like a lot of people do actually get HPV. I mean, it's a really high rate, but it seemed, I mean, it wasn't like most people are walking around with it or something.
Correct. You
Okay.
were right.
And you did say, I think you both, toss up for either of you, when you get to a certain age, it's just not even worth getting the vaccine. Excuse me.
So there's actual age limit on the vaccine. So for this vaccine that's given in adolescents, beyond age 26, it won't work. It doesn't give you the same effect. And then because HPV is so common, it's kind
There's a good chance that you already have it.
You already have it. There is a different vaccine that has been brought out that is approved up till age 45. And you would basically have to be screened to be sure that you don't have HPV before you could get it. And as far as I know, that one's not covered by most insurances.
Interesting.
Just yet. Yeah, because it's pretty new.
So it's the sort of thing that maybe if there was already a rate of incidence in your family of these cancers, maybe you might want to pursue and look into that if you're out of the age range. But
well, you know, it's actually one of those things where by the time you realize maybe you should get it, it might be too late.
yeah. Well, luckily, as those of us who were out of the age range even when it was introduced, as we age out, as this becomes a more common vaccine, that hopefully we're going to, you know, I hate to say we're going to see the end of cancer, but it sounds like we're going to see such a vast reduction in these forms of cancer that this is fantastic. This is just such great news.
This is very exciting because if you, especially over a certain age, we all remember getting pap smears, and then you'd say, and then doctors would diagnose, oh, you have an abnormal pap smear and you're going to have to return. And that usually is caused by the HPV virus. And so anyone who's known somebody who has had what they call an abnormal pap smear, someday there'll be people who don't know somebody who's had an abnormal pap smear or has had to have procedures done in order to treat the cervix. And I think that's very exciting.
Do you think that we're actually going to see the end of HPV? I mean, it's sort of a herd immunity thing I could see happening, but do you actually think that the virus itself would just be eradicated?
That would be an excellent thing. It's I don't know how possible it will be. I know that people say, I don't want to give my son the HPV vaccine because they don't have, you know, they don't have a cervix, so they're thinking cervical cancer. But because there's cancers of the mouth, there's cancers of boys' private parts, and hopefully there'll be less transmission if boys get the HPV vaccine as well.
Yeah.
So that's why we recommend it for both boys and girls. And yeah, it would be great if it all got eradicated. Maybe someday, we'll see.
Yeah, they're actually saying that, you know, there's a hope that if we're able to vaccinate with the HPV vaccine 90% of the population, they say that we can see a virtual elimination of cervical cancer.
Wow. So related to what Dr. DeLeon said, Dr. Rastogi, you'd mentioned that women, like 4 out of 5 women, I think, get HPV and cervical cancer. Is that correct?
So not every person who gets the HPV infection will develop cervical cancer. However, we don't know which people will get it and which people won't.
Was it 4 out of 5 women that get HPV will get the cancer? Was that?
No.
What did I miss on that statistic?
The percentage for that, I think, is lower. No, what I was saying is that they found that after a certain age, 4 out of 5 women were exposed to HPV, basically.
Oh, and what are the comparable statistics for men?
It was less for men. It was something like 66% or lower. I can't remember the exact number, but it was less for men, for sure.
Yeah, but 66% for men and 80% for women. This is still half
the majority.
Yeah, this is still over half the people you're going to pass on the street probably have this in their system.
Well, and based on what Dr. DeLeon saying, those women could be getting it from men, right?
Well,
absolutely.
Okay.
Well, they say it circulates and just passes around.
Right.
Yeah.
Interesting. Wow.
We're, I think we're Paul and I are sort of feeling like the noobs here because it's, you know, we love learning about it, but at the same time, sometimes you have to go slow with us.
Yes.
And we hope that anyone who's watching this recording, if they have questions, that they will reach out to their medical professionals. And, you know, at North Bend Medical Center, OHSU, anyone else who happens to see this, we're going to be putting it up on our YouTube sites at the library so anyone can go see this. And we certainly hope people will. And that you have intelligent questions to ask, but never feel that you can't ask a question that you feel is dumb. I found out so much more from the dumb questions I've asked. It's unbelievable. And, but please ask your doctors about this, take your kids in, ask your pediatrician, your medical doctors will know what you need to know about this. And we're really thankful that Drs. Rastogi and De Leon came in.
Yes.
Also, we were joined from OHSU, from Isabel Stock at OHSU, and thank you so much. She is with the practice enhancement. She is a practice enhancement research coordinator, I believe. Is that correct?
Yeah, you nailed it.
Hey, boom. And, you know, she has been instrumental in putting together this kind of panel, and we really appreciate that. So on behalf of North Bend Public Library and Coos Bay Public Library, I think we've asked all our questions, and, you know, and you can always call the library. We'll send you their information if you need to. We'll get your phone numbers. But thank you all so much for coming, and we hope that the people who watch this enjoy it. So thank you very much.
Yes, thank you. Very informative. Thanks a lot.
Thank you.
Thanks, guys.
All right, good work.
Bye-bye.